I've got a wonderful show for you today. Today is about storytelling, and it's the most riveting story that happened to a colleague of mine. So let me introduce first to you Veronica Marion, and next to her, Dr. Zhiquan Zhao. And Veronica is going to tell her story on her trials and tribulations and then triumph through breast cancer. So Veronica, take it away and tell us what your journey was like.
Thank you for even having me.
Yes.
So my journey started back in 2007. It was in the month of August, where I was just going to see my gynecologist for a regular, my annual appointment. And while I was at the appointment, I wanted her to take a look at something that I had noticed right above, the breast area. And
so up near your shoulder almost.
Almost. Right, but it wasn't in the breast, but it was right above it. Mm-hmm. And so initially I wasn't concerned because it wasn't in the breast. And initially she wasn't concerned either. And she said, but she wanted to make sure that I was okay. So she scheduled me to have a mammogram and an ultrasound.
So Dr. Zhao, is it typical for women to have any kind of a lump? I know for self-breast exam, I normally don't check up here. I pretty much just do around the breast area and kind of under the armpit. So is that typical?
It's not typical. Usually, of course, most breast cancers are found in the breasts. However, women do have accessory breast tissue extending into the armpit area, especially on the left side, because majority of women have bigger left breasts. And thus there's extension of tissue, sometimes we call tail of the breast. And certainly wherever there's breast tissue, there's a chance for cancer to occur there. Okay. And that's probably what happened to Veronica.
Okay. So then what happened?
That's exactly what happened. So I went in for the appointment, and we were doing the mammogram, and the mammogram didn't show much. And then I stayed for the appointment, and we were doing the ultrasound. Now, it was during the ultrasound that I had a feeling that something wasn't quite right, because I was there for a longer period of time, and more doctors were coming into the room. And so that was a clue for me that they were finding something. There was something that they were looking at, and they were not telling me what it was.
Okay, so Dr. Zhao, can you explain an ultrasound? I'm guessing that a lot of women probably have not had an ultrasound. Most that have had mammographies probably haven't even had an ultrasound. Right. So describe what that process is like.
Ultrasound, of course, is a different imaging study from mammogram, which is X-ray of the breasts. Ultrasound is commonly used to differentiate between solid mass versus cysts. And ultrasound is also a good tool. In Veronica's case, the mass was found really far from the main breast tissue, and it's hard for that part to be included in it for mammogram. And ultrasound certainly is a diagnostic tool in this case, also great guidance for biopsy of the tissue.
Great.
Right, so that's exactly what happened.
So more people coming into the room, you're getting nervous.
I was getting a little nervous, but so I was just, talking to myself and remaining calm. And then they pretty much said, okay, we have enough photos, or they were taking, pictures of the area. And they said I would hear from my doctor, basically. And it probably took maybe a couple of days to get the information back, and my doctor called me and wanted me to see a specialist. And so I had to go in and see a specialist to have a biopsy done.
So what's the biopsy like? I don't even
a
like the
procedure.
word biopsy because it sounds like a needle. Anything that sounds like a needle, I don't like.
It was a needle.
It's a procedure to get tissue for pathology, histology, so we can tell, of course, by the pathologist whether it's cancers or any other type of benign pathology. It can be done by a needle, usually a pretty good sized needle. It can be done by, a knife or any instruments that can be used to obtain tissue.
Yeah, good sized needle.
So I think it was a good sized needle. I think that's what happened. And it was quick. It was done right in the office. Did not
Not too
take long.
painful?
Not too painful, not at all. And then I think, so the other challenging piece was that you leave not knowing. And
Yes.
so now you just have to go home
And wait.
and wait. And that could be, a bit of a challenge.
Mm-hmm.
And so I did wait. And then the phone call came, and they asked me.
And you were at work, I think.
I was at work, and
So describe what happened. I know the story.
I was in a meeting actually, and the phone call came in through my cell phone. So I took the cell phone, and thank God my colleagues were with me. And initially they didn't want to tell me over the phone.
Yes.
And I had a feeling that if you didn't want to tell me over the phone, I already know.
Right.
So tell me over the phone. And so
And she forced her doctor
I
to
did.
tell her.
I did. And I just always felt that I was going to be okay.
Yes.
And I wasn't going to worry about
Exactly.
it. And so I got the information, and then I knew it was time for me to start making some decisions.
Okay. So, Doc, what are some of the options when a woman finds out that she has breast cancer?
You're talking about treatments?
Yes,
right?
treatment. Yeah, for treatment.
Yeah. A lot of times there's no further workup is necessary, but some physicians may recommend a little more studies, including CT scan, to make sure there's no metastatic disease. And then the next thing is to talk about surgery. Most commonly, most women will benefit from having surgery done, depending on the size of the tumor, where the location. Of course, many different types of surgery can be done, and you can probably talk what you had.
Yeah. So what I did, well, I did a little homework first.
Yes.
And I interviewed a couple of doctors because
Tell us
wanted,
about that process.
I did some interviewing. I called friends and families, and I wanted to be with someone that I felt comfortable with. And so I did visit a couple of doctors' offices, and one I felt like it was really cold and not connecting with me as a person, couldn't answer questions regarding working with women of color, and so that was a concern for me. So I knew that I was going to keep looking. And finally I did connect with someone that I felt comfortable with.
And what was it about that doctor that made you pick that doctor?
She was she was a woman, and she was a woman of color, and she took the time to get to know Veronica, and she answered my questions. She didn't rush me, and she provided me with her personal contact information.
I think that's so important. That's why I asked.
Oh.
That's how I met Dr. Zhao. I think it's really important that there's a connection between you and the doctor, that you feel confident with the doctor, that your questions are answered. I was really worried when I went in for my robotic surgery, and when I left that office, I had no more worry.
Right.
I had no more
Right.
worry. I felt like I left it in your lap, Dr. Zhao. I felt bad about that, but I was like, now I don't have to worry about it anymore.
Exactly.
He's got to worry about what he's got to do, because
Exactly.
I'm done.
Exactly.
And I found my doctor, and I'm done. And I had done the same thing, had 3 names that I was going to go visit, but he was first on the list. And that's it. I didn't end up going to see the other 2. So yeah, I think that's really important.
It's huge.
Yeah.
It's huge
Yeah.
because you already have a lot on your mind, right? And you don't want to have to be concerned about your doctor.
Exactly.
Yeah.
Exactly. So what happened next?
So the next step, the doctor and I had to decide on the treatment,
Okay.
what we were going to do. And when I said we had to decide, we came up with a plan together.
Okay.
So it wasn't just like the doctor telling me
What to do.
what to do. Exactly.
Okay.
So I felt
That's
that
awesome.
I was, part of this process. And together we decided that I was going to do chemotherapy first.
Okay. Ooh.
And so I opted to do the chemotherapy first and then do the surgery.
Okay, why the chemotherapy first, Doc?
Well, sometimes I think it depends on the location of the tumor, the size of the tumor. Some tumors can be really good in size and involve some vital organs may be involved depending on location, of course, and not necessarily breast cancer. Chemotherapy can be a sound option to do first. Once the tumor shrinks smaller in size, and there's better chance for the surgeon to get rid of the cancer completely.
Right.
Question, and this is kind of off, but if you do chemotherapy, can it get rid of the cancer without having surgery? Do you still
Rarely,
have to have
in
the surgery?
theory, there is a chance, but if the tumor is good size, you certainly
out.
shouldn't expect to see that happening.
Okay.
But that's exactly what happened.
Okay.
Within a
That's
short
what
period.
happened. Yeah, so that's what happened in my case. So
okay.
after the chemo, I did have the surgery. So I started the chemo in October of 2007, finished the chemo in December, and then in January 2008 is when I did the surgery.
The surgery.
And when they went in to remove the tumor was not there.
So the
chemotherapy.
chemo got rid of it then?
Yes.
Oh, wow. Wow. Does that happen very often, or?
I have had a couple of women in the past when I was a breast surgeon back in China. Yeah. But most women will need surgery anyway because the cancer
Wow.
was there. And we know it's a type of cancer that is very sensitive to chemotherapy. Some cancers are more resistant, some are more sensitive. Depends on sometimes. It's just bad luck, good luck.
Yeah.
Right.
Now, what's the
Yeah, good
difference
luck.
in what Veronica had and tell people what inflammatory breast cancer is? I know it's not a good one.
Inflammatory breast cancer is a rare type of cancer that is usually found on both sides.
Wow.
Yeah, usually the name comes because the whole breast appears kind of red, swollen,
Yes.
looking like this inflammation or some infectious process going on, but actually it's just cancer. The cancer cells, involves large part of the whole breast on both sides a lot of times, and it's a disease of higher malignancy.
Okay. All right. So we're going to take a quick break, but when we come back, you'll get to hear the rest of this wonderful story and her recuperation and recovery process. So stay with us. We'll be right back. Welcome back to the show. I'm Linnet, and if you're just joining us, I'm here talking with Dr. Zhiquan Zhao and Veronica Marion, and Veronica is telling us about her journey and battle against breast cancer. So let's pick up where we left off. Dr. Zhao, please tell us a little bit more about having breast cancer, what the surgery entails, and if you could also incorporate a little bit. I had another friend who had breast cancer in her family, was going to lose her left breast and decided she wanted to take off the right one as well and go for implants. So if you could speak a little bit to that.
Well, I used to perform breast surgeries in the past. I believe there's a tendency since many years ago, maybe half a century ago, that we're trying to make do smaller and smaller surgeries. And currently, most women with breast cancers are getting the so-called lumpectomy, just to remove the tumor with a little bit margin with healthy breast tissue around removed, so that overall the contour of the breast is maintained. And really, for cosmetic reason, women undergoing lumpectomy will need to have radiation therapy. Some may benefit from chemotherapy, depending on other factors, including lymph node status, whether there's cancer in the lymph nodes. Certainly, the decision making involves the physician and the patients. Some women may prefer to have mastectomy, which is removal of the breast. And that is a sound option. And I believe it is still quite often done in some countries, not necessarily in the United States. It involves removal of the whole breast. Sometimes there's a need for dissection of the lymph nodes from the armpits to see whether there's cancer in the lymph nodes. Also, there's developing a technique called sentinel lymph node dissection, using radioactive material to make sure that the surgeon can detect cancer early on with minimal surgery involved.
Can you also tell the difference, only because you raised this word for me, and for me, I don't get it. What's the difference between chemotherapy and radiation?
Radiation, of course, involves exposure of X-ray to, different type of radiation to the local tissue.
Okay.
Of course, cancer cells are more sensitive to this type of radiation, X-rays, gamma rays, and these cancer cells will not survive and they die. That's one way for treatment. Chemo involves a lot of chemical agents, usually given through the IV.
Through an IV, okay,
Yes.
That's the difference.
And some chemical agents can be taken by mouth for chemotherapy, even chemoprevention in women with high risk, in high-risk women, I have to say, with strong family history for breast cancer, and her own risk is well above the average population, then she can take certain medications by mouth to reduce her risk to develop breast cancer.
Okay, yeah. I know that Connecticut has the second highest rate of breast cancer, and I'm not sure why.
I wonder why.
Yeah,
I think we all wonder why.
Yeah, we all wonder
And I
why.
talk to my colleagues, and most say it must be related to the environment that we live in.
That's what I'm thinking.
Yeah.
It could be snow.
Diet.
The snow, the water. I mean, I don't know about
Yeah,
diet,
water.
because I think we all eat very diverse foods here in Connecticut.
Right.
That's one thing about Connecticut, is that it's so diverse. There are people from every part of the world here. So
I agree.
I'm not sure if
I
it's
agree.
diet, but I would think something more common to all of us: water, the
air.
environment, the air.
Air.
Yeah, chemicals in the air or something.
Stress.
Yeah, stress. We're all stressed
We're
out.
probably working too much.
We're all stressed out.
So slow down.
Slow
Yes,
down.
we got to slow down.
I agree.
Yeah.
I
So
agree.
what happened after your surgery?
So after my surgery, I was sent home to heal. And thank God that I had my family who rallied around me, my friends at work who took such good care of me, and the leadership at work that took such good care of me and my colleagues in establishing policies so that I, as a divorced mom, didn't have to worry about providing for my family. I could focus on my healing.
Yeah, we work for the most awesome
Yeah.
place in the world.
Yeah.
Cirque. It's the most awesome place in the world, the most
Yeah.
equitable place I know.
Yeah, I agree. So I returned back to work in April. And initially I was working maybe part-time. For the first 2 weeks, I was working part-time. But then once I was back into the office, I was like 100% and I was
Yes.
ready to go.
And always look
Yeah.
good. You
Oh,
look good through
thank
the whole
you.
process.
Thank you.
Even when I came to
Thank
see you,
you.
look fabulous, fabulous.
you.
So let's talk a little bit about your son, Trey, and
Okay.
when you decided you were going to tell him. He was only 4 years old at the time.
Trey was 4 when I was diagnosed, And I remember having a conversation with the social worker, and she wanted to know how could she help me? Is there anything that I needed? And I said, well, I have my baby at home, and do you have any children's books? Because I knew that Trey was going to be noticing the difference. I was going to be going through chemo. And so he was going to be noticing the changes. And Trey's not your average, he wasn't your average 4-year-old, still isn't. And so he's very inquisitive, and he asked a lot of questions. And so she was very excited, and she was like, yes, I do. So she ran back to her office, and she came out with these like medical pamphlets.
Textbook for the physicians.
Yeah.
Exactly.
Yeah. So I knew that wasn't going to do me justice. So I teared up a little bit, but then, you know, I got over it. But I was concerned. It did bother me.
Yes.
That I was going to have this conversation, but didn't have a tool or a picture book
To demonstrate.
to explain to him what was going to happen, because that's how I shared a lot of things with him, through stories.
So what did Trey say?
So Trey, it wasn't until a couple of years later, Trey, we as a family were talking to other families that the moms had been diagnosed. Like not necessarily people that we met or people that we knew ahead of time, but people that we would actually run into like at school, and they knew that I was a breast cancer survivor, and they wanted to know if Trey would share his experience. And so he did that, you know,
Yes, he's
drop
so
of a
bright.
hat.
He's so bright.
And he loves people. He's not shy.
He's like you.
I wonder where does he get that?
From the tree. You know, no strangers.
Yeah. So so Trey was really willing to, you know, share his experience, but it wasn't until our neighbor immediately across the street, the mom was diagnosed with breast cancer, and I think that's what really hit home for us. And so Trey said, Mom, I think we should write that book to help other kids know what their mom's going to go through.
It's awesome. It's awesome. And I have the book right here. Trey wrote the book. And who's the illustrator of the book?
The illustrator is Jean Sanchez.
It is awesome.
Jean is also a mom,
Yeah.
and she has an architectural background, but she has a passion for writing children's books and
Yes.
illustrating children's books.
Yeah,
So
show a little bit of the inside.
she did the illustrations for us.
Yeah, it's awesome. It's a beautiful book. As a matter of fact, you guys had your big debut last night.
We did.
Very well attended, all over the news media. It's really
Yeah.
awesome, and I feel so proud to even know little Trey.
Thank you.
Let's
Thank
take a
you.
quick break right here, and you're going to get to meet Trey yourself. So here's a little clip from the function last night.
When Mommy had cancer. My name is Trey. When I was 4 years old, my mom had cancer. I was scared that she wouldn't be around anymore. I was sad and mad because Mommy was sick. Mommy helped me not to be afraid. She explained what was happening to her and that we were going to be all right. I wasn't afraid anymore. I became Mommy's little helper. I'd empty the trash, pick up my toys, and dust with a feather. I did all my jobs until Mommy felt better.
Welcome back to the show. Wasn't that amazing? Trey is awesome, and you got to be so proud, Veronica. I'm so proud of
I
him.
am.
And I love the story. I cried when he read the story, talking about how you had to fix different foods for him.
Right.
Brilliant boy.
Right.
Yeah,
Right.
he is. He is.
He's a nice little fella.
He's a great
He's a
kid.
good kid. We were focusing on being brave, And so really the book is about birth control.
That's awesome. Dr. Zhao, before we wrap up, can you just go over the importance of preventive care for women and what they need to do? The minute they find something, I can't believe people don't like run to the doctor. We were just sharing a story about somebody who had a lump for years and didn't go.
We're talking about the preventative care screening for breast cancer, of course. The screening tool for breast cancer really consists of two parts. One is the mammogram. Mammogram is commonly recommended at the age of 40 and after, every 1 to 2 years until the age of 50, then every year after. Exceptions are women who have a strong family history of breast cancer or personal history, multiple biopsies at risk for having breast cancer. They may have a mammogram sooner. The other part of the screening for breast cancer is actually breast exam. Mostly, the physician's exam really counts. Certainly, some breast masses are found by women themselves, and that can be really helpful. So, self-breast exam is encouraged, even though it's not shown to make a difference. But I think it's a good practice for women to do.
Thank you so much. Thanks to both of you, Veronica, Marion,
You're
Dr.
welcome.
Zhiquan, Zhao.
You're so
Appreciate
welcome.
that story. It's awesome.
Anytime.
And so if you are a woman out there, you know what you need to do to stay on top of your health. Please do so. Thanks so much for watching. I'm Linnet, Carty, and we'll see you on the next program. And remember, I love you more than I love cooked food.